Welcome to the Washington Monthly. I'm your host, Ann Kim.
And I'm your co-host, Garrett Epps.
Every week, we bring you interesting people and fresh ideas. In this episode, President Donald Trump says he has a plan to lower Americans' healthcare costs.
So we have a very glamorous name. It's called the Great Healthcare Plan, not the Unaffordable Care Act. I don't like that name. This is called officially the Great Healthcare Plan. That means low price and great healthcare. So you're going to have, at a lower price, great healthcare.
But how great is it, really? I'm joined today by Edwin Park. He's a research professor at the McCourt School of Public Policy at Georgetown University. He's also one of the nation's leading experts on healthcare policy and a former health policy advisor for the National Economic Council at the White House under President Joe Biden. Welcome, Edwin. It's great to see you.
Yeah, thank you for having me.
So just for context, President Trump has promised for a while that he would fix the Affordable Care Act. And during his campaign, he said he had a concept of a plan. And in the meantime, premium subsidies for the ACA have expired. Millions of Americans are now facing the prospect of losing coverage or their great risk of doing so. So I looked at the president's great healthcare plan. It's one page. Is this a serious proposal? Is it even a plan? You're a professor. What grade would you give this?
Yeah, I would say, and I've said this repeatedly on social media, there's never been and never will be a credible plan to repeal or replace the Affordable Care Act from President Trump and his administration. And, as you said, this is just a one-page fact sheet with a few bullets, and it's mostly about letting the enhanced premium tax credits that help people better afford marketplace coverage expire, and they've already expired, and this includes no provision to extend those, and then some replacement funding to go to people's accounts that's going to be highly inadequate to buy coverage that actually undermines the Affordable Care Act, and that's really what this plan is about.
I want to walk through some of the elements that are proposed in his fact sheet. I'm not even sure that it's accurate to call it that. And I'll do that by playing some clips from the press conference that Trump held announcing this plan. And so let's start with the first idea that he proposes, which is reducing drug prices.
First, our proposal codifies the massive discounts on prescription drugs that my administration is achieving through our most favored nation provisions. The bottom line is we'll be paying the lowest price of any nation in the world. Whoever's paying the lowest, we match it.
What is he talking about here, and is this a real proposal?
Yeah, he's announced drug pricing agreements in the fall of last year with a handful of manufacturers, and these manufacturers have said that they'll agree to offer bigger discounts, lower net prices for the Medicaid program, potentially for those who are purchasing drug coverage on their own, whether they're uninsured or they have limited drug coverage in their plans. But based on some of the policy details from the administration about how they would actually implement this, for example, in Medicaid, it's voluntary on the part of manufacturers, it's voluntary on the part of states, and states already get the largest discounts under Medicaid today. So it's a question of whether, is this going to be much bigger discounts, lower net prices than what state Medicaid programs already get today, and whether manufacturers are going to participate in great numbers. What are the discounts actually going to look like? And do they even have to provide discounts on all the drugs that they currently manufacture? And that's all unclear. So there's many unanswered questions about this approach. And so whether it actually will lower drug prices significantly is still up in the air.
Now, he did also unveil Trump RX a few months back. Is that related to this effort? And have you seen very much on whether that has been panning out to deliver the gigantic discounts that he also promised with that?
Yeah,
initiative?
the idea is there will be some sort of website called Trump RX where people, particularly those who are uninsured, could purchase drugs out of pocket at a lower price. But again, we have, no information about what that website would look like, what those discounts are for the drugs that are subject to these agreements. Again, it's a limited number of manufacturers, and the manufacturers appear willing to participate, because they may be getting lower tariffs being imposed, but of course, those tariffs are constantly changing, and whether they're actually going to get different application of those tariffs and in turn encourage them to participate is still just hard to know at this point.
Another plank of this plan is to lower health insurance premiums, but instead, as you pointed out, renewing the premium subsidies under Obamacare, he wants to send cash directly to Americans to pay for health care.
So Obamacare was designed to make insurance companies rich with taxpayer subsidies, and I want that extra money straight to the health savings accounts for you. And you can choose your own health care. You go out and negotiate your own health care. It makes people entrepreneurs, mini entrepreneurs. They'll pick the health care that's best for them because it's so different.
So it sounds appealing to a lot of people, right? I mean, what are the dissect this idea and explain why maybe this isn't the best way to reduce costs.
Yeah, this is an old line of thought among conservative health policy folks that instead of people pooling their risk as part of an insurance pool and they're insured against catastrophic expenses, instead people would get tax favored accounts and they would basically purchase healthcare services, the cost of going to the doctor, cost of going to the hospital themselves using these accounts. And so instead of providing additional help as under the ACA enhanced subsidies to purchase marketplace plans under the Affordable Care Act. Instead, a limited amount of money would go into accounts. They could use that to buy insurance potentially, but that insurance may be substandard. It may not have to comply with the rest of the Affordable Care Act. Some of the similar proposals on Capitol Hill talk about allowing insurers to charge much more for older people. They wouldn't be pooled together so that sicker people would pay higher premiums in the marketplace, but you'd be siphoning off healthier people in these separate plans, substandard plans, or you could purchase coverage on your own. And the idea is rather absurd that people would then have an incentive to negotiate with a physician, with a hospital, with their pharmacy to get lower prices. And obviously they don't have any leverage to bargain for a lower price, but also in an emergency situation, you're not going to be able to decide to price shop across providers when you have a traumatic brain injury, you have a heart attack, or you have cancer. You need the care that you need immediately.
Right, right. And this proposal also seems to assume that the amount of money that's going to be provided to consumers is going to be enough either to pay for the coverage or to pay for the care directly. And that just seems unrealistic as well, right? I mean, we'd be talking about trillions of dollars in cash to people to pay for.
Yes, I mean, it's just, they're talking about, a limited sum of money, $1,000, and that's not enough, particularly since it's a flat payment, irrespective of income. The subsidies are, um, vary. They're greater for those with lower incomes who need more help to purchase health insurance, and even some of these plans don't include any financial help or contributions for children. So for those who are, have a family, they're buying a family coverage today in the Affordable Care Act marketplaces, they wouldn't get any help to purchase that family coverage. It would just be, for the adults in the family. And so it's going to be insufficient. And as I said, these are sort of finite amounts of funding. And the goal really is to purchase coverage on your own. But we know that if you go to the hospital, we're talking 6, 7 figure price tags. Some of the breakthrough drug therapies have 7 figure price tags. A little bit of money is not going to be able to help a family afford the healthcare services they need. They need health insurance, and they need to be insured against catastrophic costs if they end up, very sick and need a lot of healthcare services.
Yeah. And to the extent it does help anyone, it would really only be very high income people who would benefit, right? Because we do have existing health savings accounts
Mhm.
and so called high deductible plans, but the deductibles are really high for the most part, right? And the evidence shows that the people who are taking advantage of these plans tend to be more affluent
Yeah,
folks, right?
the we've seen already with the expiration of the enhanced subsidies, a lot of people moving from so-called silver plans to bronze plans. But these bronze plans have deductibles, 5, 6, $7,000, and that's just simply unaffordable for low and moderate income families. And as you say, the experience with health savings accounts, these tax favored accounts that are already in law and they've been in place since the early 2000s, is that they're primarily a tax advantage tax shelter for high income people to save more on top of the retirement contributions and savings that they're already accruing in these other accounts. So, it's primarily going to help those who already don't need help to pay for their health care.
Yeah. Now, there is this final set of ideas that's also in this plan that seem to focus more on disclosure and on transparency. And it does seem it goes back to this idea, which you've already kind of trashed as kind of ludicrous, of this ability to negotiate prices. The second thing he refers to is a cost sharing reduction program that he claims will save money. So I'll play the clip, and I'd love for you to explain both of these.
It also funds the so-called cost-sharing reduction program to bring down the cost of the most common plans on the exchanges by more than 15%. And next, the Great Healthcare Plan mandates unprecedented accountability and transparency from insurance companies and all healthcare providers. We want transparency. You're not allowed to ask a doctor how much is it going to cost. You're going to have your heart ripped out, and you're not allowed to negotiate. This is a giant scam. You're supposed to go into a hospital and get operated on. Then they send you a bill and you have to file for bankruptcy. Not going to let that happen.
Okay. So let's start with the cost sharing reduction program. Can you
Yeah,
explain what that is?
Yeah, ironically enough, this harkens back to the first Trump administration. So under the Affordable Care Act, there are subsidies, premium tax credits to help you purchase the health insurance in the marketplace. But there's also so-called cost-sharing reductions to lower deductibles and other out-of-pocket costs like co-payments under those plans. And the Trump administration in its first term blocked funding for those cost-sharing reductions. In response to this action by the first Trump administration, insurers did what's called silver loading. It's very complicated, but they are funding those cost-sharing assistance, lower deductibles and copays, by increasing the cost of their plans. And so they're able to afford that way because those premium tax credits are still available to purchase those plans. And you have to be in a silver level plan to get this additional help with deductibles and co-insurance and copays. So that's what's going on. So the Trump administration now in its second term is saying, oh, we're going to reverse what we did in the first term, and we are going to fund them. Now, that has actually the effect of lowering the amount of premium subsidies that still remain available under the underlying Affordable Care Act subsidies. So while it lowers unsubsidized premiums, it increases the out-of-pocket costs for those who are subsidized, and more than 90% of those participating in the marketplaces are receiving some sort of subsidy. So it has the effect of lowering their premium tax credits, making their coverage less affordable, and that's why the Congressional Budget Office has previously estimated that's going to increase the uninsured by about 400,000 to do so. So this isn't about making coverage more affordable, it's about making it less
affordable in a bait and switch sort of way. Okay. So now the big push on transparency. So the text of the plan, the one pager, says that Trump wants, for example, for providers to, quote, prominently post their pricing and fees in the place of business. So is this going to have any impact at all? I mean, in the clip, Trump talks about having your heart ripped out and not being able to negotiate. It seems he's defeating his own argument here about.
Yeah, these are just talking about posting list prices, but the only ones who pay list prices today, even if they're more transparent, are those without health coverage, who are self-pay. They're purchasing coverage on their own, but that's not the price of a service for most people who are insured, because whether it is Medicare and Medicaid setting certain payment rates, whether it's private insurers who negotiate on the behalf of employers and individuals enrolled in those plans, they're using their overall leverage to negotiate lower prices. So even if these list prices are available, it goes back to what we discussed earlier, an individual patient is just going to have very little ability to get a physician, a hospital, another provider, a nursing home, so forth, to lower their prices just because They have some money in their accounts and they're willing to pay for it outside the normal insurance channel. And so transparency is helpful, but is it really going to make a coverage more affordable? It's highly unlikely just because people can't bargain for lower prices in any significant way. And that's even more so in the case of a medical emergency.
Yeah. So it doesn't sound like a terribly great healthcare plan. Uh, However, GOP, Republicans in the House and the Senate, seem to be bending over backwards to incorporate some of these proposals into their own pieces of legislation that they're proposing. One of these groups is the Republican Study Committee, and that's a group of the more conservative members of Congress, and they've put together a plan for a second reconciliation bill to put before Congress this year. And it does seem to include many of the provisions we've talked about earlier, but it also includes a lot of ideas to cut Medicaid even more, especially for legal immigrants to the United States. And Edwin, you recently wrote about this for Georgetown. And can you walk through some of the more egregious provisions that you saw in this RSC proposal?
Yeah, one of the provisions of HR 1, the Budget Reconciliation Law, was enacted in July of last year, would eliminate eligibility for Medicaid and the Children's Health Insurance Program for many legal immigrants as of October of this year. That includes refugees, those granted asylum, victims of domestic violence and human trafficking. What the Republican Study Committee proposal is goes even farther and eliminates Medicaid eligibility for all legal immigrants, so only citizens could get Medicaid. And so this is just a proposal for a second reconciliation bill, but it's quite extreme, where it already takes a harsh provision from the budget reconciliation law last year and says, um, all those with legal permanent residence who have green cards, they would lose their coverage. Children and pregnant women who many states cover through so-called IKEA option through Medicaid and CHIP, they would lose their coverage. Those from Cuba and Haiti who remain eligible, despite the HR 1 provision, would lose eligibility, as well as migrants from certain South Pacific islands. And so it would eliminate eligibility for many millions of legal immigrants who are otherwise remaining eligible for Medicaid and CHIP. They would have their coverage eliminated, and they would very much likely go uninsured. And that's already, would be on top of the 10 million plus who would lose eligibility under the budget reconciliation law from last year, the nearly 5 million who would lose coverage under the expiration of the enhanced premium tax credits under the ACA, but this would be millions more just from this one provision in the RSC proposal.
Well, and if I remember right, even before HR 1, welfare reform legislation from 1996 had already put like a pretty significant waiting period for eligibility for legal immigrants, right? I mean,
Yeah, yeah.
yeah,
As
to go
part of
long way
that,
back.
you had to wait 5 years after getting an adjustment of legal status to get Medicaid and CHIP. The only big exception was for, as I mentioned, kids and pregnant women. States could cover those populations in Medicaid before that 5-year bar, and more than half of states, and both red and blue states, have taken that up. This proposal from the Republican Study Committee would take that all away.
So let's talk about a couple things that more things that are happening and also what you would like to see happening. There is this bipartisan healthcare plan that was put together by some members in Congress. It does not extend the ACA subsidies, from what I understand, but it does go after pharmacy benefit managers and expands funding for some democratically supported priorities like community health centers. What's your take on this package and what it's supporting?
Yeah, I think it's, what Congress used to do regularly, which is, have as part of the annual appropriations process some so-called health extenders, some other bipartisan proposals to be added to appropriations for health and human services. And that's what this package does. These extend some expiring provisions, including provisions related to Medicare and telehealth coverage, which was first provided at the height of the pandemic, a provision that cuts Medicaid funding of hospitals that's been delayed periodically, and that's what this proposal does, but also does some additional things like making it easier for children who require specialty care to find providers out of state that they might not have in their own state. for their needs, making it easier for, let's say, a children's hospital in a neighboring state to enroll in that kid's state's Medicaid program. So there are some positive things. And, it's welcome change. It hasn't been enacted yet, but it's a welcome change that there still is the opportunity for some bipartisan legislation that can move forward that will have some, make some positive improvements to Medicaid and other parts of the healthcare program.
What else would you like to see Congress doing? Let's set aside the question of the ACA subsidies being extended, because obviously we'd like that to happen. But if you had to pick one or two priorities that would actually work to lower the underlying healthcare costs that are responsible for premiums rising to the extent that they are, what would you want Congress to prioritize?
I think one thing would be to, particularly for low income and moderate income families, is reverse or delay many of the cuts that were enacted in HR1, which are going to increase the number of people who are uninsured. And that's going to mean foregoing needed healthcare services that could have a long term impact. We know research shows that if you have, for example, Medicaid coverage in childhood, those kids have higher educational attainment. They're more likely to finish high school, go on to college. They're more likely to be healthier as an adult, less likely to be suffering from disabilities, having to go to the emergency room, and they're more productive economically in terms of higher earnings. And if you want to ensure, a better future for the next generation, preventing these healthcare cuts from last year, these draconian cuts, is certainly something that I would hope Congress would do in coming years.
And I think it's really important to emphasize that covering people who need insurance actually lowers healthcare costs for everyone, right? When somebody who's uninsured shows up at the emergency room, that drives up premiums for the rest of us. And so much of the dialogue around Medicaid and around welfare programs generally seem to be about who deserves coverage and who doesn't. But just from a pure self-interested standpoint, Americans need to recognize that covering all of us protects all of us, right?
Yeah, and also, the hospitals, the physicians in your community, if they're closing their doors, if, you're in a rural community and the hospital ceases operations, cuts services, cuts staff, that means that even if you're privately insured or you're covered by Medicare, you can't go to your provider anymore because they're not offering the care that you need, or they may not be in operation at all. And we know that, rural hospitals disproportionately rely on Medicaid for their revenues because rural families rely on Medicaid to a greater extent than those in other communities.
Well, thank you, Edwin, for your perspective. I'm Ann Kim, a senior editor at Washington Monthly, and I'm joined today by Edwin Park, research professor at the McCourt School of Public Policy at Georgetown University. Thanks again, Edwin. Take care.
Thank you so much.